morning. I'm Rashunda Breland. I'm a student from Mississippi University of Women, and today I'll be talking to you about the national opioid crisis. The opioid epidemic and opioid crisis is a term that generally refers to the rapid increase in the use of prescription and non-prescription drugs. By the end of this presentation, I expect for you to understand the opioid epidemic and be able to identify commonly used drugs on a daily basis, and also understand the prevention of methods used to decrease opioid overdose. The opioid epidemic can lead to trauma, opioid pain addiction, death, emotional abuse, and prescription mental health. The opioid epidemic is the misuse of and addiction to opioids. This includes prescription pain relievers, heroin, and synthetic opioids such as fentanyl. Also, a rising incidence in newborns experiencing withdrawal syndromes due to the mother being addicted to opioids during pregnancy. In the beginning, in the late 90s, pharmaceutical companies assured the medical community that patients would not become addicted to these drugs. From there, physicians started providing these to patients and selling them at a high rate. The opioid epidemic has evolved rapidly in the recent years. Since the 1990s, there have been 3 waves to the epidemic, started in 1991, 2010, and the latest was 2013. These led to increased deaths. Addiction to opioids includes prescription pain relievers, heroin, and synthetic opioids such as fentanyl patches. Opioids comes in many shapes, sizes, forms, and solutions. Addictions to these opioids is a serious national crisis that affects public and social and economic welfare. Again, these commonly used drugs include fentanyl, oxycodone, hydrocodone, morphine, and codeine.
Hospice 6405,
These are used daily in the health profession. Facts include, according to the CDC website, estimates that a total economic burden of prescription opioid misuse alone in the U.S. is about $78.5 billion a year, including the cost of health care, lost productivity, and criminal justice involvement. That's more than 25% of the patients get their prescriptions from physicians. More than 50% of the non-medical users get their prescriptions from friends and family members. About 21% to 29% of patients misuse prescribed opioids that they get from their physicians. More than 700 people in the U.S. have died from the drug overdose in 2017. Death rates include more than 40,000 a year that has increased over the past years. That's more than 115 people per day that have died from opioid-related drug overdose. Prevention. Prevention starts with the clinician, patients, and pharmacists. Physicians, their patients, and the pharmacists all can play a role in identifying and preventing non-medical use of prescription drugs. According to the CDC, more than 800 million grants and supports to treat, prevent, and recover efforts have been provided over the years. They expect us to crack down on this prevention ahead of time before many patients get addicted. Prevention starts with the public. Protect your family by safely storing and disposing medications. Talk to each family member about dangers of drug use. Recognize the signs of medicine abuse, and know treatment options ahead of time. Ways to prevent include better data, better pain treatment, more addictive prevention and recovery services, more overdose reversals, and better research. Patients can also take a role by taking steps to ensure that they use prescription medications appropriately, by following directions as given by their physician and never using another person's prescriptions. Providers can also lead in this prevention by starting prescribing non-opioid pain relief. If the opioids appear to be necessary, begin with a low dose, and of course, research the medicines before prescribing. Providers can also check their state's PDMP to keep control of patients' prescribing activities. Nurses can also play a role by assessing pain in details with their patients, such as location, duration, frequency, and what relieves those symptoms, and informing the doctor of this information. Health and Human Services.gov has a 5-point strategy to help target opioid crisis. This can be located on www.healthandhumanservices.gov. This lists all the information that was given to you today in the presentation. If you have further information that you may need, you can always look on those websites, including the CDC website. Thank you.